All right. Hello, everybody, and welcome to another edition in our Austin Wellness series here, where I am interviewing local practitioners. I started this series because I was making it a point to meet these other fantastic practitioners in the area here, because I kind of nerd out with them and love hearing about what they do. And there's the opportunity to refer to each other and help our combined patients a lot more. And as we were having these conversations, I just found I should be recording these because there's so many people that could benefit from the information that we're talking about. So that's what we're doing today. And today I'm happy to welcome Dr. Tenesha Wards. She is a chiropractor, but she has some specialties. She focuses on chronic fatigue, Lyme disease, autoimmune conditions. And then we were actually just talking briefly before the call here that she also has a newer specialty in post-COVID patients, which we'll definitely want to dive into because it's such a relevant topic. But welcome. Thanks for coming to the interview today.
Hey, thanks for having me. I'm excited to chat.
Yeah, great. So we'll definitely get to your areas of expertise because I think that's where I have most of my questions. But let's start at the beginning. How did you get into this field of medicine?
Yeah, I've got a couple interesting stories that led me here. The first I would say has to do with my dad. When I was as young as 8 years old, he was diagnosed with MS, and he tried a lot of natural things and never went on medication, including things like bee stings, which, in the early 90s was unheard of. It's become more popular since. And it ended up being that they removed his metal fillings and his neurological symptoms and got better. And
Wow.
he went from literally half of his body numb and just kind of drooping and bedridden to being able to function. Still has some neuropathy at the bottom of his feet. He lost vision in one eye, but also his lesion stopped progressing in his
Wow.
brain when he had this done. And again, in the 90s, like, this was crazy. Some people still think it's crazy, but
Right.
like,
Yeah.
how would the metal, mercury cause, we know now it crosses the blood-brain barrier, but back then it was a miracle. So, and he's dealt with some other things and some flare-ups and things through the years, but that was probably my first introduction to something more alternative or natural. And then at 15 years old, I became very, very ill, and my joints wouldn't bend. I had excruciating pain in my joints. I described it as literally, it felt like shards of glass from the inside out, like scraping my joints. And I was covered in a rash. Woke up one day like this, and I was
Oh,
bounced from doctor to doctor, missed a lot of school. And finally, it was a doctor that practices very much like I do now that took one look at me and said, I think, and my mom did her own research also and found this doctor. It's like, I think she has Lyme disease. Again, in 1994, very much something unheard of. However, growing up in Michigan, we were in the woods. We had ticks on us. So it made some sense. And I was textbook. I had the bullseye rash that ended up spreading through most of my body, but started as a
yeah.
bullseye, which now we know only about 30% of cases get.
Mm.
So I found the right doctors, and through a lot of treatment, liver detoxes, candida diets, I mean, you name it, thyroid help treatment, antimicrobials, I was able to get well and catch up in school and graduate and go on to do this. So that's kind of the story of my alternative health, I guess, introductions to alternative health. But I didn't start there. I actually started, and I have an undergrad degree in radiology, and I started as an x-ray tech and worked in the hospitals. And then I actually started working for a chiropractor in undergrad in her office. And yeah, long story short, I realized I hated my job. I was working second, third shift in Flint, Michigan, in an
Mm.
ER, and then outside of Detroit, and just hated what I was doing. And it was dealing with things like gunshot wounds and stabbings and working,
Oh,
nights. And she said, why don't you go to chiropractic college? You've had all this experience with holistic medicine, and you loved your job here. You were so happy. Go. And so, like, literally within a month, I was enrolled and went across country to Texas.
oh my goodness. And I mean, it's such a it's so interesting because it's such a common story. I mean, meeting other practitioners like yourself and then going through a master's program in acupuncture for me, but I'm sure it's probably similar in chiropractic
Mm-hmm.
school. It's so common. It's like I got really sick and conventional medicine failed me. So I went kind of off the beaten path and felt amazing. And, usually there's a winding road in between there, but eventually you kind of make your way to I need to help other people know that this is an option out there.
Totally. I don't think that this is a career choice as much as it is, and I'm sure you'll agree, a calling,
Yeah,
right? Like the suffering that I went through, the suffering that my father went through, people don't have to endure that.
right.
And I think that becomes our mission and our passion. And yeah, we just want to spread the word and help people. And yeah, it's not a 9 to 5 job, that's for sure. And yeah, I want to
No.
tell as many people as possible, look at other things. I actually wrote a book called What to Do When Your Doctor Gives Up on You. to,
Oh,
there's other, you can find on Amazon. There's other things out there that you can look at doing. And yeah, I think the best practitioners have gone through, the best doctors have gone through the sickest, darkest times.
oh
And
yeah.
that gives us the tenacity to work with our patients so closely.
Yeah. I mean, when it's personal, you just know that. I mean, you wouldn't wish that pain and suffering on anybody else, and you're going to fight for folks who are dealing with it because you've literally been in their shoes, and it's
Absolutely.
horrible. Yeah.
Absolutely.
Well, good. I'm glad that I'm not happy that you had to go through that, but I'm glad you made it to this point. And so now you kind of identified areas of focus. And do you focus on these conditions um, because they're the hardest to treat through conventional means, or because or is there another reason that you kind of focused on these areas of expertise?
Yeah. So when I graduated chiropractic college in 2006, I was in Houston, outside of Houston, and I knew I wanted to come to Austin, and I actually found a doctor retiring. This was, yeah, 2006, and she practiced like how I wanted to and how I was learning and taking postgraduate courses in. And her focus was chronic fatigue, fibromyalgia, hormone balancing. So,
Mm,
and I really believe this, and I think you'll probably see this too. I feel like your practice kind of follows you.
mm,
So she was in her mid to late 50s, and she was seeing a lot of menopause patients, a lot of fibromyalgia and chronic fatigue. I came in, took over the practice, and I started doing a lot of fertility cases. Like I was
mm.
just younger, and I think that, so still doing a lot of hormone work. Um, but what was interesting is I would sit with patients and put my hands on them. I do kinesiology and muscle testing, and the fibromyalgia cases and the chronic fatigue cases, I started I started saying, this sounds like Lyme. And I just started having a spidey sense, I guess, or medical intuition, whatever you want to call it, or just experience. And so I started running a lot of Lyme tests. And I would say 80 to 90% of the fibromyalgia cases were Lyme disease or some other form of tick-borne illness. And I also was digging a lot into Epstein-Barr virus at the time and autoimmunity as well, which I dealt with later after the birth of my daughter later in life. Fortunately, I knew how to find it, but
Yeah.
yeah. So I started digging. Like, I'm not accepting these, for lack of a better word, BS diagnoses. I think they're real, but I also think they have a cause.
Yeah.
So the practice shifted a little bit, and more people just started showing up with these things that we would then identify. And again, they were slapped with a label that I think is really just a set of symptoms. So we started finding and correcting some of these underlying infections. And so
Wow.
that's kind of been my focus since. I'd say about 5 or 6 years ago, I really got into genetics, and I'm doing a lot of epigenetic work of running people's, genome and doing nutrigenomics. What can we change with nutrition and diet and exercise and supplementation? So I started seeing a lot of MTHFR defects. I'm
Mm,
sure you're familiar with that. That means a lot of things. That you could be a poor detoxer, you may not make energy well. And I found a huge correlation with people with the diagnosis of chronic fatigue and fibromyalgia that we sometimes find, Epstein-Barr virus or Lyme. They also have a really poor detox pathway in their
mm,
genetics.
Makes sense.
So I do a lot of that too. Or they would have detoxed the infection out, right? Their body would have seen it and gotten rid of it. And if they have some defects in that pathway, I think. So we go all the way down to your genetics when we try to rebuild the system.
Yeah, and I mean that's such a crucial step, and for some reason it's lacking so much in the more conventional approaches where a functional medicine approach is really getting down to figuring out, okay, what is the underlying root cause of all of this? And in conventional terms, we have all of these diseases that we're able to say a name for, but a lot of times it's just a collection of symptoms, and we can't really go beyond that. We can't say what is actually causing that. So, like
Yeah.
you're saying, if you have somebody coming in with fibromyalgia, that probably doesn't even really do you that much good. You need to figure out, okay, what is your fibromyalgia? Like, what specific symptoms are you having? Let's run some other tests to figure out how do we actually get these symptoms to go away, because just giving you
Hmm.
some generic fibromyalgia drug is kind of like just shooting shooting in the dark and hoping it hits something.
Totally. And it doesn't fix anything, right? Sometimes
Right.
it just covers up symptoms. But I am finding that conventional medicine is starting to use a lot of genetic testing, specifically the MTHFR gene in fertility cases
Yeah.
and some neurosensory disorders. Like a lot of medical doctors are saying, oh, okay, you've had a lot of miscarriages. That could be due to the MTHFR gene, which converts folic acid and folate into methyl tetrahydrofolate, which is
Oh.
MTHFR for short. And that's the first nutrient that's needed to form the baby's brain.
Uh-huh.
So I am seeing patients come in from fertility clinics with a slew of tests, and they're having some genetic testing. So that to me is really exciting that they're kind of catching on to that. And then I don't do, this is not my passion of ADD, ADHD. I definitely have worked with some more adult than child. Um, Children are tough to work with,
Yeah.
but I've seen a lot of children come from neurosensory clinics here in town and all over have a whole genetic panel of their detox pathways. So I think that's really cool. It's I think it's slowly kind of cracking into some of the more specialties of conventional medicine, and that's exciting.
Yeah, yeah, and I think, in a city like Austin, because it is more progressive and because there are practitioners like even the more conventional MDs are kind of having to, they're probably getting a lot more questions than than they would be getting, in other parts of the country. So I'm thrilled to hear that too, that I mean there's so
Yeah.
much to offer with all of these different forms of medicine. I think if we can just all work together, hold hands and work together, we'll be able to do so much more for our patients.
Yes, yes. And most of the time practitioners want to do that. I feel like
Oh
work
yeah,
together for
totally.
the most part. Yeah, I feel like that's common. Yeah.
Yeah. And what sorts of autoimmune conditions are you working with?
Definitely a lot of thyroid. We see a lot
Okay.
of Hashimoto's. We
Yeah.
run pretty much everybody who's suffering from fatigue or sleep issues or hair loss. That's something we rule out. Of course, GI issues, autoimmunity. We'll run some stool samples that could tell us if there's autoimmune markers in the gut. And honestly, I believe most all autoimmune disorders can be looked at the same way of finding the cause for the attack, removing it, and then calming down the inflammation. And sometimes that could be a food allergy. Gluten can flare up the thyroid. Then the body looks at it and it's like, oh, there's inflammation. Let's go attack it. It's doing what it's
Yeah.
supposed to do. Um, Sometimes it can be toxicities. They're not a good detoxer. Underlying infections, I think, can flare up an organ and then the body wants to attack it. So we find sometimes in stool samples a lot of parasite infections or bacterial infections. And um, yeah, the body's doing what it's supposed to do and attacking the tissue, but that causes a whole slew of other issues too.
Sure. Yeah. And it seems like autoimmune conditions are so much more prevalent than they once were. Do you have a feeling of like, okay, they're actually not more prevalent, we just know a lot more and we're able to diagnose it more? Or do you think there are environmental factors that are causing a lot more of this to flare?
I think it's probably both. I
Yeah.
think that our food sources and supplies are getting worse and worse, right? There's less nutrients, there's more dyes and preservatives and toxins, right? So that breaks down our gut lining, which makes us our immune system less strong for sure. I think that's a lot of it. There's so much stress right now in life. I mean, beyond everyday rat race, right? Being in a pandemic and with election stress. I mean, all of it so much. I think that can matter too. I think that breaks down your immune system and can cause inflammation. But also, you're right. There's so much more testing that we know now and what to look
Yeah.
for. I mean, even 5 years ago, the stool sample test quality is not what it is now. I mean,
Mm,
even 6 or 7 years ago, we couldn't run the type of genetic testing that we're doing for under $1,000. It was $5,000 or $6,000, right? Only the rich and wealthy could afford to
yeah.
get their nutritional genetics run. So yeah, I think testing is becoming more prevalent. There's more labs. It's easier to do. I mean, genetic testing is a cheek swab now, right? So like, it doesn't get much easier than that.
Right.
So I think you're right. Testing has gotten better. Science has gotten better, and our food quality's gotten worse, and our stress has gotten worse.
Yeah.
Yeah. So I think it's a perfect storm, and that is one of the reasons I think personally, what I'm seeing is why we as Americans are being so hit by COVID, because I think, I mean, all lots of countries are, but I feel like we can't quite get on top of it because we're already so stressed and we already have such a poor food quality. And I think again, that's a perfect storm. We're just not as a country as healthy as some other places.
Yeah, and it's such a, like you said, it's a combination of so many different things, and I think that's really hard for some folks to still grasp. Again, I think in Austin, more people are probably aware of this, that there are a lot of different variables that go into whether or not you are healthy and you're going to kind of have a
Hmm.
robust immune system and have a, a long life full of vitality. But
Yeah.
the conventional approach for so long was just like, nope, you're fine if you don't have a whole lot of pain, or if something's not like
Yeah.
infected or something, you don't really need to worry about your health. You're doing just fine. So I think
Yeah.
it's important, and I'm glad that more people are catching on to the fact that real health is multifaceted, and you can't just kind of, no, I'll kick that can down the road a bit. It's going to catch up to you eventually.
Totally. And I hope if one good thing comes out of this whole pandemic is that it's a little bit of a realization or wake up call for
Yeah.
a lot of people. I mean, I definitely treat a lot of I don't know, trainers and other healthcare practitioners, and they're saying that they're busier than ever and so many more people are, and again, this could just be Austin, right? But that are wanting to get in shape for the
Yeah.
first time in their life. They're really wanting to get on top of their health. They want it, they know they don't sleep well, and they're like, oh my gosh, that can make me more susceptible and my immune system low. I want to
Yeah.
figure that out. So I am seeing some good in that sense.
Yeah, right. The silver lining, right?
Yeah,
it's
I'm an
it's a
optimist.
it's a shame that we had to go through a pandemic to find that silver lining, but it
Yeah,
is what it is. But
absolutely.
but yeah, because you just touched on it, and because I'm really interested in it, you mentioned that you're treating some post-COVID patients. Tell me about what people are experiencing after. I mean, I guess if they're getting over COVID and then coming to see you, they've still got symptoms that they're working through. What types of things are you seeing?
Yeah, it's really really interesting. And again, they just kind of started showing up. People that had COVID but now are testing negative, like the 2 or the 3 weeks or however long they were sick is up, but they're still having a couple lingering symptoms. And I've seen it be severe to where they can't function, they can't get out of bed, they can't go back to work, to where they just can't make it up a flight of stairs without getting pretty winded, or they're just a little
Mm,
more tired than normal. I've also seen some things like POTS, where you stand up and your heart rate goes up really, really high, a postural issue with heart rate. And then some people like will pass out from it. Um, I've seen headaches, migraines, definitely some lingering fatigue. Like I didn't have this fatigue before COVID, and I just can't shake it now. And it's affecting my work and my family. And um, that's probably a big one. Some sleep issues. I mentioned headaches and migraines. Some pain. Some patients have had some neurological pain that they didn't have before. But the breathing is probably kind of across the board. The getting out of breath really quickly. Um, Chest tightness still. Like I'm
mm,
talking 4 and 5 months later, not
yeah.
just 3 weeks later. Like this is still an issue, some people complain of like a band around their chest, still 4 or 5 months later, can't exercise due to shortness of breath.
Mm-hmm.
And I have some thoughts on why some people are having an issue and some are completely recovering and they're like, no big deal. I had cold and flu symptoms for 3 days. I'm totally fine.
Right.
I think, and it could be again a combination, I think that they probably had some other underlying issues that COVID is triggering, maybe infections, autoimmunity, but also I'm running a lot of genetics on these patients, and they have a lot of genetic defects that I think, because the virus is so intense, that it's turned the genes on, right? We know that genes can be turned on and turned off.
Mm-hmm.
Just because you have the breast cancer gene doesn't mean you're going to get breast cancer necessarily, right? A lot of it's diet, lifestyle, stress, other illnesses, right? The whole thing, environmental issues. So I think that, well, I know that everybody that I've run genetics on that has a lot of post-COVID issues, like the severe ones, have a slew of genetic defects that I think are
Yeah.
expressing now. I think
Yeah.
that's a big one. So yeah, I think it's a combination of things. And I also just think, it matters when you're hit with any illness. In taking a history with our patients, anytime they got sick, let's say they said, I've been sick for 5 years. I'll say, okay, what was happening 6 or 7 years ago? There's
Right.
always a major life event, a triggering event, a trauma, something they're going through stressful, right? Like, oh, I just lost my spouse, or I'd gone through a divorce. So I also think it could matter on the state of your mind, immunity, emotional health, and stress when you get hit with the illness and how sick you get. I think that matters
Mm-hmm.
because our immune system matters, right? When we're in a healthy, happy place, it's stronger. When we're not, it's not. So I think there's a lot of things that could be contributing to these post-COVID syndrome patients, which they call themselves, which is interesting, long haulers. And
Mm-hmm.
Dr. Fauci has referenced that. And there is a case study going on, I believe at Harvard, that he's heading up right now with people who still have these weird symptoms. And it's sad, like a lot of other diseases like fibromyalgia or chronic fatigue, a lot of people in their families and their life don't believe them. Well, you're testing negative. Why are you
Right.
still
You
in
should be
bed?
fine. Right.
Yeah. So it's really sad. And it's really scary, honestly, that they're being left like this.
Yeah, but I mean, what you're saying, it makes such perfect sense to me, especially with all the neurological symptoms that you're describing. It's something that I find I'm talking about so much more with my patients is when your nervous system is operating so frequently at this elevated state because of the pandemic, because of systemic racism, all
Totally.
the things that we're having to deal with as a society. Even if you don't feel it consciously, there's subconscious anxiety levels are just so high right now. And when it's at that state for such long periods of time, there's only so much energy to go around in the body. So if it's being used up at this low level or even a high level just base of anxiety, things are going to fall down. The immune system is not going to get all of the support that it needs. The rest of the nervous system is going to start kind of falling down on the job, and that's when we start to see symptoms. And once they get COVID or some other life event happens, it just kind of puts them over the edge, and the whole system kind of like a house of cards just starts to break down. It makes perfect sense to me.
100%. The other thing that happens is, you mentioned systemic racism and just the stuff that's thrown us into fight or flight that we're dealing with. I mean, homeschooling, right?
Yeah.
People getting furloughed, people having to work from home, like all of that has put us into high cortisol, fight or flight. Well, we know that to make that cortisol and adrenaline to keep you upright, the body's going to rob Peter to pay Paul. It's going to
Yeah.
steal all the good nutrients and enzymes from our gut lining, right, to make more energy. And so then that leaves us with a thinner gut. The term leaky gut comes to mind, and that is our immune system.
Yeah.
We've all seen those yogurt commercials that say 80% of our immune system's in our gut lining. I mean,
Yeah.
brilliant marketing. Wish I would have thought of it to word it like that, right? But it's true. So that's why people under stress get ulcers. So yeah, if your gut's not properly functioning, it's probably oftentimes due to stress. Now you're more susceptible to everything that comes along.
Yeah.
The other thing I think we're forgetting right now is, I'm seeing in my clinic people are having cold and flus, strep throat. There's a stomach flu going around in Austin right now. Strep throat is starting to get really prevalent, right? So COVID's not let's not forget COVID's not the only
Right.
infection,
Right.
right? We need to keep ourselves strong against too. So
Yeah.
yeah, if we're stressed, we're way more susceptible to that stuff.
And I mean, going back to, us being really focused on treating the root cause of these issues, I'm certainly focused on, you know, recommending to my patients that this would be a fantastic time to either restart or start from fresh, a
Yes.
mindfulness practice, starting exercise again, getting regular acupuncture would be fantastic. What other tips do you have for folks to help with prevention and helping their body be as, robust as possible for whatever comes their way next?
Yeah, now's the time. And we're taking our patients, we're like our post-COVID patients, we're just doing what we do. We're not changing anything in how we treat them. And it's things like getting refined sugar out of your diet,
Yeah.
increasing your water intake, eating, using food as medicine whenever possible, eat your antioxidants, fruits, vegetables, clean meat. All those hormones in the meat it does not help your immune system or your gut lining, right? It tears it down. I mentioned water, sleep. I think you mentioned
Oh
that
yeah.
one. Yes, taking care of your body, exercise, body work. So many people are like, do I go in for acupuncture and chiropractic? Don't I? Only you can decide that. Both boost immune system, both, increase nervous system function. All that matters. So it's really, I think, important to take care of your body right now, lowering stress the best you can, finding and uncovering and correcting underlying causes that maybe you've been dealing with for 10 years. Like now's the time to figure out, why your bowels don't function, or why you have fatigue and insomnia or anxiety, right? Like now's the time to kind of balance the body. But yeah, I would say, oh, the other one, sunshine, vitamin D. There's so many research articles right now with COVID and vitamin D, and COVID and zinc, and COVID and vitamin C. Those you can find them on PubMed. That's not like secret new news to us, right? To
No, no.
functional practitioners. But I'm super excited. I feel like that just started hitting the media maybe 3 months ago.
Hmm.
That they're doing tests with the people that are getting COVID had below
Yeah.
30, on the lab test of vitamin D. That's the next question always people have. Well, how much should I take? Well, what's your levels?
Right. Let's
How,
get you
how
tested.
deficient?
Yeah.
Yeah, how deficient are you? But, you know, getting sunshine, just getting outside and, starting there. And I tell people, you got to get outside without sunscreen on and show some skin. So, if you're wearing sunscreen and long sleeves and long pants,
And a
you're not
mask.
actually absorbing. Yeah. And a mask. No, you're totally right. Yeah.
Yeah.
And a mask. So that's the thing, getting outside, getting exercise with, showing skin to get the vitamin D absorption. Um, but yeah, those are kind of seems like common sense, right? Let's drink our water. Let's lower refined sugar. Let's eat right. But it's a conscious effort. Like we have to
Yeah.
now more than ever make that our priority in our life's mission to stay healthy and, treat it like it's a life or death option of, I always tell patients, when you put something in your mouth, is it hurting you or is it healing you? Ask
Yeah.
yourself that question. If it's hurting you and it's inflammatory and you're conscious of it and you're going to do it anyway, you're going to eat the wedding cake, like do it. But then let's, get back to food that's healing you, kind of thing. And just making those conscious choices.
And just knowing that, yes, it is a conscious choice, but it gets easier. I mean, with any habit, maybe you're really good about, some of these things, but not others. You don't have to tackle all of them at once. Changing these habits is absolutely possible if you just give yourself a little bit of time, and then it's not as big of a conscious effort every single time you get shown that piece of chocolate cake. If you're if you're able to
Yeah.
train yourself over time slowly, then it's really not that it's not that big of a deal. If you try to change all of these at once, that'd be terrible.
Yeah. Yep. No, I agree. It definitely, yeah, takes habit and time, but we can do it. Like
Yeah.
everybody can do it. Yeah.
Yeah. And those vitamin D studies are pretty remarkable, how the severity is just, I mean, so closely linked with how low or high your vitamin D levels are. So I'd say if there's one
Yeah,
takeaway from this, it would be a good idea to have your vitamin D levels checked out, and
absolutely.
and supplement if you need to, and if not, just keep getting out in the sunshine.
And I'm a big fan of zinc right now. Zinc, we know, stops viral replication.
Mm,
So I think that it's a good one to just have in your system, just one more barrier to fight a virus. Like you might still be exposed and get it, but it'll stop it from growing and getting worse in your system. So that's a big one I'm testing for people right now too.
yeah, I mean, I'm operating under the assumption at this point that I'm going to be exposed to it if I haven't already been exposed to it. And I think everybody probably should be operating under that, and if it's not
Yeah,
COVID, it's going to be the flu. So
totally.
you have to prepare that way. I mean, you don't have to be crazy about it, and be crazy about like not leaving your house or anything like that, but just prepare your system for what it's likely to be exposed to.
I've said that before. I feel like it's not if, it's when,
Yeah.
right? You're going to be exposed to bugs, right? We live in this environment. Just can you be stronger than them?
Right.
That's I think that's what it comes down to. Are you a good opportunistic host because your immune system's weakened, or are you strong enough to tell them like, hey, you can't live here, you
Right.
can't set up shop here. We're going to kick you out. Yeah, so I think it sounds so simple, right? But there's so many layers, as you said, physical body work, nutritional work. Like there's so many layers to what sneaks through and what doesn't. Yeah.
Yep. Yep. Which is why, practitioners like you fighting the good fight for folks are that much more important.
Yeah.
So thank you for doing what you do. And if somebody wants to get in contact with you, if they want to make an appointment, how can they get in touch?
Yeah. So if they're local to Austin, our website is Austin Holistic Doctor. So Austin Holistic DR. And our handles on Instagram and everything is Infinity Wellness Center, ATX. And then I also do some long distance health coaching, and that's called the Energy Recovery System. And it's specifically for women suffering from chronic fatigue.
Okay. Awesome.
And
So
that
a couple
we can
different
see
ways.
people all over the country. Yeah. Yep. That way.
Okay. Well, very good. Well, thank you again for joining me today. I find these conversations really fun because I love learning about what
Yes.
other practitioners who are like-minded kind of approaching the body from a holistic perspective and functional perspective. I love hearing what you're focused on and doing. I think it's super interesting, and hopefully other folks are finding this interesting too. So thank
Yes.
you for joining, and I look forward to talking with you and working with you as we go forward here.
Yeah. Thank you for getting this information out there. People need to hear it.
Yeah, yeah, they certainly do. All right, well, take care, and we'll talk soon.
Thanks.